Greetings, my friends. Today's lecture will be about monogenic diseases, their diagnosis, prevention, and treatment. Your doctor, Bezrukov Grigory Sergeyevich, Doctor of Philosophy in Medicine. Monogenic diseases, MDs, are diseases whose etiology is based on a single gene mutation. MDs are inherited according to Mendel's laws. Currently, according to various literature data, 4,500–5,000 nosological units of MDs have been described. They are detected in 3–6% of newborns and in a structure of the total mortality of children under 5 years old. They account for about 10–14%. Classification of monogenic diseases. Since the manifestation of monogenic diseases depends on the nature of the mutant gene, there is a classification depending on a type of inheritance. Allocate, autosomal dominant, autosomal recessive, linked monogenic syndromes. The autosomal dominant type of inheritance is characterized by the following features. There are patients in every generation. A sick child from sick parents. Man and woman are equally affected. The manifestation of a symptom is observed vertically and horizontally. The probability of inheritance is 100% if at least one parent is homozygous, 75% if both parents are heterozygous, and 50% if one parent is heterozygous. This type of inheritance includes the following pathologies. Brachydactylia, which is known as short fingers, osteogenesis, connective tissue disorder, Marfan syndrome, arachnodactylia, retinoblastoma, Pierre-Robin syndrome, neurofibromatosis, achondroplasia, and gargulism. Brachydactylia, which is known as short fingers. One of the classic examples of dominant trait inheritance is brachydactylia. This sign is rare and occurs, as a rule, only in one parent. If a parent has a trait, on average, half of the sons and daughters have this trait. Brachydactylia can be detected already at birth by a change in the phalanges of the fingers and toes. Deviations from norm, in this case, do not threaten a person's life, do not make him an inferior member of society. Osteogenesis, which is known as connective tissue disorder. It has an autosomal dominant pattern of inheritance. At the same time, a defect in one gene leads to multiple disorders. A tendency to fractures of bones due to a lack of calcium in them. A tendency to dislocations associated with hypermobility of the joints. Marfan syndrome, which is known as arachnodactylia. Patients have a pronounced aesthetic type of build, which is tall stature, thinning of the subcutaneous tissue, muscle weakness, elongation of the fingers and toes, dolichocephalia, a change in the shape of the head, when the longitudinal size significantly exceeds the transverse. The so-called bird's face, which is face that is narrow with closely spaced eyes, thin nose, and protruding upper jaw, prognathy. Deformations of the auricles, high palate. Sometimes there is a splitting of the hard palate, which is known as cleft palate. The limbs, fingers, and toes are elongated. The chest is funnel-shaped or keeled. The ribs are thin and low. The intercostal spaces are wide. The spine is curved. Here you can see an example of Marfan syndrome. Here you can see some people which are known for Marfan syndrome. On the left you can see the famous Paganini and Abraham Lincoln. Retinoblastoma, malignant tumor of the retina. It occurs in approximately one newborn in 15 to 34,000. Typical are multiple foci of tumor growth on the retina. Most patients die from tumor spread to central nervous system along the optic nerve. The disease is usually presented with a symptom of cat's eye, white pupil. Pierre-Robin syndrome, characterized by a change in the type of brachydactyly in conjunction with the involvement of the pathological process of the skeleton of the front part of the skull, ribs, spine, as well as damage to a number of internal organs like heart, lungs, kidneys, and genitals. Neurofibromatosis, severe multi-system disease. The population frequency is 1 to 3,500 newborns. Patients are characterized by the following main symptoms. Light brown spots on the skin. Age spots appear in childhood and their number increases with age. 2. The presence of 2 or more neurofibromas. Their number increases with age as well. Multiple freckle-like pigment spots in the armpit, inguinal region, on other parts of the body with folds. Here you can see the example of those features. Achondroplasia is a syndrome of disproportionate dwarfism. In patients, the growth and development of cartilaginous tissue in the epiphysis of tubular bones and at the base of the skull are disturbed. The population frequency is 1 to 100,000. Children lag behind in motor development. Intelligence, as a rule, does not suffer. Gargulism. Gargulism comes from the word which means French gargoule, the stigma of a drain pipe in the cathedrals of Gothic architecture, decorated with the fantastic figures with ugly faces. Synonyms: multiple dysostosis, lipochondrodystrophia, polydystrophia, osteochondrodystrophia is a disease caused by a severe hereditary pathology of the connective tissue, manifested by a combined lesion of the osteoarticular system, eyes, internal organs, and nervous system. First described by Gunter and Gerler. Ellis proposed the term gargulism because of the characteristics appearance of patients. Here you can see how the French gargoyle looks like and how it looks similar to the person on the right. Autosomal recessive type of inheritance. It is characterized by the following features. Patients err not in every generation. A sick child is born to a healthy parents. Man and woman are equally affected. The manifestation of a symptom is observed horizontally. The probability of inheritance is 25% if both parents are heterozygous, 50% if one parent is heterozygous and the second is homozygous for a recessive trait, and 100% if both parents are homozygous recessive. This type of inheritance includes pathologies: albinism, phenylketonuria, alkaptonuria, tyrosinemia, progeria, Ehlers-Danlos syndrome, ichthyosis, cystic fibrosis. Albinism: congenital absence of pigment in the skin, hair, iris, and pigment membranes of the eye. It occurs in different populations with different frequencies, from 1 to 5,000 to 1 to 25,000. The main clinical manifestations of albinism at any age are the absence of melanin in the skin cells, its milky white color, very fair hair, light gray or light blue iris, red pupil, increased sensitivity to UV radiation that comes from the sun. Here how the albinism in different races looks like. Phenylketonuria occurs with a frequency of 1 to 6,000 to 1 to 7,000. It was first described by geneticist Fellin in 1934. Its development is based on a sharp decrease in the activity of an enzyme that converts the amino acid phenylamine into tyrosine. In people homozygous for this mutation, the concentration of phenylamine and a number of other compounds that have a harmful effect in the blood is significantly increased. As a result, homozygous children lag behind in development. They have brain damage and mental retardation. On average, one person is 50 is heterozygous for the phenylketonuria gene. The peculiarity of phenylketonuria is that it manifests itself in the first year of the child's life and slowly progresses. Increased excitability of muscle tone appears. Hyperflexia, tremor, and convulsive seizures develop. A characteristic sign is the presence of a mouth smell from the patient. Patients have weak pigmentation due to impaired melanin synthesis. Without early treatment, this disease makes the child disabled for life, as it causes poisoning of brain cells, which is known as brain intoxication. Here how it looks like. Diagnostics. Produced by a semi-quantitative test or quantitative determination of phenylamine in the blood. In untreated cases, it is possible to identify the breakdown products of phenylamine in the urine, not earlier than 10-12 days of the child's life. It is also possible to determine the activity of the enzyme in a liver biopsy and search for the mutations in the gene. Treatment and prevention. At the birth of a child in maternity hospitals, a blood test is taken for 3-4 days and neonatal screening is performed to detect congenital metabolic diseases. At this stage, detection of phenylketonuria is possible, and as a result, an early start of treatment is possible to prevent irreversible consequences. With timely diagnosis, pathological changes can be completely avoided if, from birth to puberty, the intake of phenylamine with blood is limited. The late start of treatment, although it gives a certain effect, does not eliminate the previously developed irreversible changes in the brain tissue. alkaptonuria. Patients are characterized by symptoms, by the following symptoms: lesions of the musculoskeletal system, eye damage, and heart defects like valvular calcification. Tyrosinemia. Mutations lead to disruption of tyrosine metabolism with damage to the liver, kidneys, and peripheral nerves. The first affected organ is the liver. During the first months of life, there are initial manifestations of liver dysfunction with a long-term outcome in cirrhosis and hepatic carcinoma. Some patients develop nephrocalcinosis and kidney failure. An increase in the level of tyrosine and methionine in the serum causes the appearance of cabbage smell from patients. Progeria. Parents with progeria often have a characteristic appearance: short stature, a relatively large skull, and reduced face part of the skull. Progeria is characterized by a complex of changes in the skin and internal organs due to premature aging of the body. The main forms of childhood progeria and adult progeria, which is known as Werner syndrome. Ehlers-Danlos system causes insufficient development of collagen structures in various body systems. It is manifested by pathology of the skin, musculoskeletal system, cardiovascular system, eyes, hyperextensibility of the skin, which is skin taken in a fold is easily pulled back. In this case, the retracted skin fold quickly returns to its original position. The skin is thin, delicate, velvety to the touch, weakly fixed with the underlying tissues. Musculoskeleton include chest deformities, kyphosis, scoliosis, clubfoot. Teeth in patients may be malformed, abnormally located, reduced in size, or partially missing. Mental development of patients in most cases corresponds to age. Ichthyosis. Hereditary dermatosis characterized by a diffuse violation of keratinization by the type of hyperkeratosis. It is manifested by the formation of fish-like scales on the skin. Cystic fibrosis. It is characterized by a systemic lesion of the exocrine glands and is manifested by severe disorders of the functions of the respiratory organs, the gastrointestinal tract, and number of other organs and systems. The frequency of cystic fibrosis is, according to different authors, ranges from 1 to 2 and 500 to 1 and 8,000 newborns. The disease is inherited in autosomal recessive type, characterized by cystic degeneration of the pancreas, interstitial glands, and respiratory tract due to a blockage of the excretory ducts with the viscous secret. Manifests itself in the form of chronic phenomia, digestive disorders. Sex-linked inheritance. X-linked recessive type of inheritance. It is characterized by the following features. Patients do not appear in every generation. A sick child is born to healthy parents. Predominantly men are ill. The manifestation of the disease is observed mainly horizontally. The probability of inheritance in 25% of all children, including 50% of the boys. Healthy men do not transmit disease. X-linked dominant type of inheritance, similar to autosomal dominant, except that the man passes this trait only to daughters, because sons receive a Y chromosome from the father. X-linked recessive inheritance includes color blindness, hemophilia A, syndrome of Lesch-Nyhan, and muscular dystrophy. Color blindness or color vision deficiency. Partial color blindness is a type of color vision disorder. The Dr. Dalton was first who described this in 1794, and he himself suffered from this deficiency. Color blindness occurs in 8% of men and 0.5% of women. It is assumed that there are 3 elements in the retina of the eye, each of which perceives only one of the 3 primary colors, which is red, green, and violet, by mixing which all the shades perceived by the normal eye are obtained. This is normal, so-called trichromatic color vision. When one of these elements falls out, partial color blindness occurs, dichromasia. Hemophilia A, severe disease caused by a defect in factor VIII, blood clotting. It occurs with a frequency of 1 to 2,500 newborn boys. It is characterized by multiple hematomes, hemorrhage in the large joints of extremities, subcutaneous intermuscular and intermuscular hematomes, bleeding during injuries and surgical interventions, and the presence of blood in the urine predominate. Hemorrhage in the joint cavity lead to the development of the persistent stiffness due to osteoarthritis. Lesch-Nyhan syndrome. In the first months of life, there is a delay in the development of motor skills. The disease is accompanied by oligophrenia, the child's tendency to self-harm, like biting fingers, lips, the inner surface of the cheeks. The high content of uric acid and its salts, despite the increased excretion in the urine, leads to the formation of the stones in the urinary tract, the disposition of uric acid salts in the joints, and gout. Muscular dystrophy. Severe disease manifested by muscular weakness and increased level of creatine phosphokinase in the blood plasma. Phenotypically, the disease is manifested by a duck gait, lumbar lordosis develops, and pterygoid scalloper develop. Later, usually after a few years, immobility develops. The atrophic process also develops in the heart. Acute heart failure is the cause of death. The life expectancy of patients is approximately 20-35 years. Eye-linked dominant type of inheritance include enamel hyperplasia, vitamin D resistant rickets. Enamel hyperplasia, a sharp tanning on the enamel accompanied by a change in the color of the teeth. Spots and defects of various shapes appear symmetrically on the teeth. Here you can see the type. Vitamin D resistant rickets. There is a violation of many types of metabolism, which leads to a violation of bone formation and a change in the functions of various organs and systems. Usually, curvature of long tubular bones, ankle and knee joints are deformed. An unusually low concentration of inorganic phosphorus in the blood. Prevention of hereditary diseases. Diagnosis of hereditary carriage. Prenatal or antenatal diagnosis and intrauterine correction of fetal pathology. Preclinical diagnostics. Medical genetic counseling. Early postnatal diagnosis of hereditary diseases that can be treated. Clinical examination of families with hereditary pathology. Control of mutagenetic environmental factors and hygiene regulators. Promotion of medical genetic knowledge. Treatment of hereditary diseases also includes diet therapy, which ensures the intake of optimal amounts of substance in the body, which relieves the manifestation of the most severe symptoms of diseases. Pharmacotherapy, periodic injections of missing proteins, different factor globulin enzymes, blood transfusion, which temporarily improves the condition of patients. Surgical methods, removal of organs, correction or transplantation. Treatment of hereditary diseases also includes eugenic measures, compensation for natural human deficiencies in the phenotype, including hereditary, which is improving human health through phenotype. Thank you for the attention.